I remember the first time that a doctor yelled at me. I wanted to just sink into the ground and be swallowed up by the earth. It was so embarrassing. The phone was up really loud, so everybody heard him giving it to me, and he laid me out. Was it wrong for him to do that? Yeah, it was wrong, but it was even so more unprofessional and inconsiderate to call a doctor at 2 a.m. to wake him up when the issue could have been addressed if I would have just done a few more things before calling him. So I'm going to tell you guys what you should do before calling a doctor so that you will not get yelled at. Okay, so the first point is don't call doctors without any reason to call them. There's always something that you can do for your patient before placing a phone call to a doctor. Number one, take a full set of vital signs. Sometimes we get reports from our aides that our patient's blood pressure is 80/20, or that our patient's blood pressure is 220. You guys somebody's calling me for an NCLEX. Wait. Never take someone else's word for something, okay? Go in there, do a full assessment on your patient. If their blood pressure is low, recheck it, because sometimes what happens is a patient will get up and go to the bathroom, and they'll come sit down, and the aide will come in and take their blood pressure. Their heart rate is up. Their blood pressure is up. So if you go in there, maybe you'll get a different reading. So you go in there, you get a full set of vital signs, you ask them about pain, you ask them when is the last time they had a bowel movement and the last time they made any urine. What you would really hate is you would call the doctor and you would say, hey, my patient's blood pressure is such and such, and he'll say, okay, what's their heart rate? And you're like, hold on, all right? Doctors hate when nurses put them on hold to get information. Second thing you do, you grab the chart. Okay, you want to be able to have this information at your hand if the doctor asks you, okay, what was the last order written? What did the cardiologist write today in the progress notes? These are things that doctors will ask you if you call them. Because remember, the doctor who may be on call, he could not have never seen your patient before. He probably is not at all familiar with their condition, with their case. He's just a general doctor covering the team. So he's going to need to have information in order to make a good decision. Having that chart there will give you so much information about your patient's history, what the doctors are currently doing, progress notes, everything. Grab the chart. Number 3. Check the PRN orders. And this really should be something that maybe you should even do before you call the doctor or grab the chart or anything, because sometimes in the PRN orders, the situation is addressed. Okay, sometimes the doctor will write, if the patient's blood pressure is this, administer this, or if the patient's blood sugar is this, do this. Okay, the PRN orders sometimes will address those emergency situations. So number 3 is to check the PRN orders. Number 4 is grab the MAR. The MAR is the Medication Administration Record. And this is for my hospitals that are still paper charting. If there's any, everybody should be computerized now. But if you're still paper charting, grab the MAR. If you're not paper charting, pull it up on the screen. So while you're talking to the doctor, you can say the last time this patient got any pain medicine was 4 hours ago, and he reported that there was relief with the pain medicine. Okay, this is what I'm trying to tell you guys. Having that information will make you look like a more competent nurse. There's a less likely chance of the doctor yelling at you. Another thing is, remember, you're trying to work with the doctor in order to make the decision at most effective. So let the doctor know that you tried to do something as well. So even if it's just changing your patient's position, if your patient had a temperature and you saw Tylenol on the PRN orders, administer the Tylenol, wait some time, and see if there's any change. So when you call the doctor, you can say, hey, this is the situation. I've tried A, B, and C. I need to know how you want me to proceed. You know, and that will allow the doctor to be able to troubleshoot more effectively in making his decision. Because remember, he's at home in the bed, half asleep, you know, not at all familiar with this patient, probably. So put yourself in the best situation, okay? Take your own vital signs, grab the chart, look at the PRN orders, have the medication administration record pulled up so that you can be a great nurse and not the one getting yelled at on the phone. All right, I hope that helped you guys. Bye-bye.